Urinary incontinence in women refers to the involuntary leakage of urine, which is more common in women due to factors like pregnancy, childbirth, menopause, and the female anatomy. It can significantly affect quality of life, but effective treatments are available. Types of urinary incontinence in women. 1. Stress incontinence. Description: leakage occurs when there is physical pressure on the bladder, such as during sneezing, coughing, laughing, or exercising. Causes: weak pelvic floor muscles, weakened urethral sphincter, damage from childbirth or surgery, e.g., hysterectomy. 2. Urge incontinence, overactive bladder. Description: a sudden, strong urge to urinate that may result in leakage before reaching the bathroom. Causes: overactive bladder muscles, neurological conditions, e.g., stroke, multiple sclerosis, urinary tract infections or bladder irritation. 3. Mixed incontinence. Description: a combination of stress and urge incontinence. Causes: may result from multiple contributing factors, such as childbirth and aging. 4. Overflow incontinence. Description: the bladder doesn't empty fully, causing constant dribbling or frequent small leaks. Causes: bladder obstruction, rare in women. Nerve damage, e.g., from diabetes or spinal injury. 5. Functional incontinence. Description: inability to reach the bathroom in time due to physical or cognitive impairments, e.g., arthritis, dementia. Causes specific to women. 1. Pregnancy and childbirth. Increased pressure on the bladder during pregnancy. Vaginal delivery can stretch or damage pelvic floor muscles, nerves, and supportive tissues. 2. Menopause. Reduced estrogen levels weaken the tissues supporting the bladder and urethra, increasing the risk of incontinence. 3. Anatomical factors. A shorter urethra in women makes it easier for urine to leak when bladder control is compromised. 4. Age. Aging leads to muscle weakening and reduced bladder elasticity. 5. Hysterectomy. Removal of the uterus can affect pelvic floor support and lead to incontinence. Symptoms: leakage of urine during physical activity or exertion, stress incontinence. Sudden, uncontrollable urge to urinate, urge incontinence. Frequent urination, including waking up at night to urinate. Dribbling of urine after urination, overflow incontinence. Constant wetness or dampness. Diagnosis: 1. Medical history. Symptoms, triggers, and frequency of leakage. History of childbirth, surgeries, or chronic conditions. 2. Physical exam. A pelvic exam to check for pelvic floor weakness or organ prolapse. 3. Tests. Urinalysis, to rule out infections or other causes. Bladder diary, tracks urination patterns and leakage episodes. Urodynamic testing, measures bladder function. Imaging, ultrasound or cystoscopy for structural abnormalities. Treatment options. Lifestyle changes. Fluid management, avoid excessive fluid intake, caffeine and alcohol. Bladder training, gradually increase the time between bathroom trips to improve control. Weight management, reduces pressure on the bladder. Pelvic floor therapy. Kegel exercises. Strengthen pelvic floor muscles to control urine flow. Recommended for stress and mixed incontinence. Physical therapy. May include biofeedback or electrical stimulation to improve muscle function. Medications. For urge incontinence. Anticholinergics, e.g., oxybutynin, solifenacin, reduce bladder spasms. Beta-3 agonists, e.g., mirabegron, relax bladder muscles. For postmenopausal women. Topical estrogen creams to improve urethral and vaginal tissue health. Devices. Pessary, a vaginal device to support the bladder and urethra. Urethral inserts, temporary plugs to prevent leakage during specific activities. Minimally invasive procedures. Botox injections, relax overactive bladder muscles. Nerve stimulation. Sacral neuromodulation or percutaneous tibial nerve stimulation, PTNS, modulate bladder signals to the brain. Surgical treatments. For stress incontinence. Sling procedure, supports the urethra using synthetic or natural materials. Bladder neck suspension, stabilizes the bladder and urethra. For severe cases. surgery to address prolapse or reconstruct pelvic support structures. Complications: social and emotional impact, embarrassment, isolation, or reduced confidence. Skin issues, irritation or rashes from constant dampness. Urinary tract infections, increased risk due to incomplete bladder emptying or leakage. Prevention: practice regular pelvic floor exercises. Maintain a healthy weight. Avoid bladder irritants, e.g., caffeine, alcohol. Stay physically active to support overall pelvic health. When to see a doctor: frequent or significant urine leakage, painful urination or signs of infection, sudden onset of incontinence. Urinary incontinence in women is treatable and manageable. Would you like advice on exercises, specific treatments, or additional details?